So can you treat diabetes without medications? That's the question I'd like to discuss with Dr. Khalil today. My name is Dr. Noha Polack. I am a pediatrician. I've been practicing pediatrics in Union City and Bayonne, New Jersey since 1996. Dr. Khalil?
Yes, good morning, everyone. My name is Khalil. I'm a family medicine physician. I'm board certified in family medicine and obesity medicine. I've been practicing for 5 years.
Wonderful. So Dr. Khalil, I don't have a lot of diabetic patients, but I guess adults, in adult medicine, you do. Can you educate me about what can they do besides taking medications?
Sure. So unfortunately, especially over the last few years, the one thing we've been noticing is with the rise of the weight pandemic, or not having a healthy weight pandemic, we definitely seen a rise in the incidence of diabetes, which raised the conversation about what else can we do besides for medication to help treat this. One conversation I always have with my patients, the most important thing at that point is really reverting back to the basics. Let's make sure that the diet we're following is a very healthy diet. A lot of patients ask me the question, well, doctor, what do you consider healthy? What do you consider unhealthy? It really has to dive into taking a closer look at everything we eat from the morning to the night, and that raises the question, is this food that we're eating at this particular point sugary or not? Is it a high dense calorie? Is it processed or not? So it's usually a very long conversation that I love to have with the patients, but it's the most important. The more we strict with a diet that's based around natural, healthy foods, fruits and vegetables, the better we are. The more we divert, the more likely we'll run into trouble.
Understood. So would you say that they should concentrate on the nutritional value of each food rather than exactly what's in it? Is this what you mean to say?
So when it comes up to what should we focus on, I think I'm a strong advocate in precision of medicine, which means based on your past medical history, it might give us a different focus or not. For if someone is very, let's say, uncontrolled diabetes versus someone that has very high cholesterol, the focus we might have is slightly different. Where in uncontrolled diabetic patients, we really want to focus on the carb intake and the sugar intake. So we want to make sure that's really where we would like it to be, and that goal. Versus someone, let's say that, there's just maybe a slight issue with the sugar, but their cholesterol is really out of control. That gives us a little bit different focus on the fat intake as well. Strong advocate in precision medicine. I don't think it's a one size fits all. So it's something to discuss in more details with the patients based on their detailed past medical history.
Gotcha. So the answer is it's personal. It's personal approach. Gotcha. Understood. What else can they do besides eating real healthy, Dr. Khalil?
Staying physically active is very, very, very important, especially when we notice we're starting to have issues with our blood pressure or our sugars. Taking on that physical activity, committing to it, becomes really much more important than previously discussed, because now it's really part of the treatment plan and not just the prevention. So I think sticking to that is crucially important. Other things I recommend the patients to get are also the vaccines. I think that's one of the overlooked part. If you're a patient that's been diagnosed with diabetes, please make sure you get your preventative vaccines every year or as scheduled. So the flu every year, the pneumonia vaccine, we strongly encourage you to stay in touch and stay up to date. Now, there are vaccines that are recommended as well.
Wonderful. Understood. So is there any specific exams that you would recommend for diabetics to help them stay healthy?
Absolutely. So one of the common things we do is usually do blood work or a test called hemoglobin A1C. That's a test that's done periodically every 3 to 6 months, ideally every 3, just to see how your average sugars have been. And that gives us a general idea if things have been controlled or not. The other test we usually do is called the CMP. That's to make sure that the kidneys are still healthy and there hasn't been any effect on there. Many times we'll do a urine test as well to make sure there's no protein, which can also be an early sign that we might be running into some issues with the kidneys. Again, a lot of what we do is usually try to be more proactive, preventative. One yearly test we strongly recommend in all our diabetic patients, it's a detailed eye exam and foot exam to make sure there are no signs of any complications and no indications that we need to be more aggressive with what we're doing.
Understood. And in addition to that, I understand you also recommend eye exams and foot exams for diabetics. Is that right?
Absolutely. On an annual basis. It gives us a lot of good information. It makes us really feel more comfortable that we're not running into any complications that we need to be aware of, or we need to be more aggressive with our treatment.
Perfect. Thank you for educating all of us about diabetes prevention and treatment. Where can patients find you? Dr.
So I currently practice out of Clifton, and starting December, hopefully we'll be at a new location with you in Union City alongside Dr. Noha. And you could check out our website, www.advocarePanoramaMedical.com.
Wonderful. Very good. Thank you. Bye-bye.
Bye-bye.